He called me from a hospital bed. That's the story of Peter, my latest patient to solve inflammatory bowel disease, Crohn's disease, in 6 weeks naturally after joining my clinic and using the mind-gut immunity method. Lots of valuable information here, so stick around. Hi there, I'm Dr. Chanu Dasari. I'm a surgeon who specializes in reversing gut microbiome dysfunction and autoimmune inflammation. My technique for reversing symptoms in as little as 6 weeks is called the mind-gut immunity method, and it has helped thousands of patients over the years get better from autoimmune disease and digestive dysfunction. If you'd like to learn more, visit mgiclinic.com and request a discovery call with me. Now, in this upcoming video, you're going to meet Peter. He's an entrepreneur who had Crohn's disease for decades. He actually had an operation many years ago to remove parts of his colon, and he called me from a hospital bed with a near total obstruction of his bowel. He had 2 surgeons who recommended he get intestinal surgery when he called me. Despite the initial challenge of getting him out of the hospital without a surgery, he was able to bounce back within 6 weeks and avoided an operation. Here you're going to see Peter and myself discussing his progress at around the month 3 mark. Not only was he able to avoid an operation, he's no longer obstructed from Crohn's disease, and he's off all biologics and symptom-free. Here we go. All right, my friend, we are at week 12, right?
Yeah.
How we
Yes.
feeling? How we doing?
Feeling good. I was pretty bad 12 weeks ago, really bad. But now things are a lot. They've turned around significantly, so everything's a lot better.
Good. Hey, I had some questions for you. So, how have you been doing recently? You've been doing okay?
Yes, for the first time I can say I have energy. I haven't had energy in a long time. Like everything has been a mission for me. But like my energy levels, I'm able to not have, stomach pain. I used to have this really bad stomach pain in the lower right part of my abdomen, and that's non-existent. I'm getting better sleep, but everything's just been a lot really good for me. So
Are you in the gym?
yes, I've been going to the gym, taking it easy, but like I haven't been to a gym in so long. Like I forgot what it's like to go to a gym, but now I've been going to the gym a few times a week now. So
Good. And how's business? You back in the game?
yeah, so like as far as like working and stuff, everything's coming together. So
Good,
everything's pretty
good.
good.
Hey Peter, tell me, this is kind of unusual, right? Like, we were just laughing about this last conversation. So like 3 months ago, you were basically calling me from a hospital bed, right? Like I've never ever had somebody basically sign up from the program from a
Yeah,
hospital. It was just it was crazy, it was ridiculous. I was like, I even when I first got, I was like, I don't know if this is a good idea. I was like,
yeah. Yeah, no, that was a really bad, I was in a really bad situation. I I couldn't stop throwing up. I couldn't stop going to the bathroom, but mainly I was vomiting uncontrollably. I couldn't hold anything down, not even water. Like I'd drink like, a couple gulps of water and it would just all come out. I'd have to vomit. So I had to go to the hospital. And as soon as I went to the hospital, they did a CT scan, and 2 surgeons and a doctor, they rushed up to my bed and they're like, we have to do surgery right now.
because
And then,
you got diagnosed with a total obstruction. You had a total obstruction, a bowel obstruction, right?
yes, in my ileum.
From the Crohn's, basically in the ileum, right? From the Crohn's, and that's probably why you had that pain in that right side, right? That
Yeah,
ileum is totally strictured down because of the inflammation, and you couldn't eat anything, right? Like nothing.
nothing, nothing.
Wow. Yeah.
Yeah.
And how long before that had you had Crohn's disease? Like how long?
So I've been diagnosed with Crohn's since I got diagnosed with it when I was 15 years old, but I had symptoms from the age of like 8 or 9 years
Mm-hmm.
old. And then when I was 18, I had an intestinal surgery
Yeah.
in the same exact spot in the ileum. And then I was like symptom free for a really long time. I wouldn't say symptom free, but it all started coming back like after COVID, like right after COVID came, that's when all my symptoms started coming back, and then it just got worse and worse and worse, and the pain became worse and worse.
Yeah,
So
you
I
were
ended up in the
interesting.
hospital.
I know
Yeah,
you're interesting because you had surgery already. You already know what that process looks like, and then now you were like kind of cornered with like two surgeons, like basically saying, "Hey, you got another obstruction because of the Crohn's.
yeah.
You probably need surgery, right?"
Well, I was based. They were like, you have to have surgery.
Oh,
That's
they
just,
didn't give you a choice, right?
yeah. They're like, you have to have surgery. They even put an IV, um, like in my arm, like a second IV for the surgery. Like they were, it was
Oh, they
ready.
were ready to take you back,
Yeah, yeah, it was ready.
back to the
They were ready
operating
to
room.
perform, do the surgery, and I was
So
just like,
what happened when so what was going through your head at the time? Like, what were you thinking?
I was scared. I was like, I don't want to do intestinal surgery because last time I did intestinal surgery, I almost died. I lost 9 pints of blood.
Hmm.
I woke up in the ICU. Even during the surgery, um, they had to cut me back open again because I started bleeding inside. So I
Oh,
had a lot of complications. I was in the hospital for like exactly I think 25 days.
oh, wow.
Yeah, so it was really a bad experience for me. So I never wanted to experience that again. And then
This is when you were 15, right?
no 18. When
18.
I was 15, I got diagnosed.
Okay, this is
When
when
I
you
was
were
18,
18.
I went to surgery. Yeah.
So when you were, so you didn't want this to happen. So when you were in the hospital and you were diagnosed with a total obstruction, this most recent time, which was basically 3 months ago, right? I mean,
Yeah.
it's hard to believe. This is like early May, brother. Can you believe
Yeah.
it? Not early March, sorry, early March.
Yeah.
I mean, it's literally 3 months ago, which is crazy.
Mhm.
Um, so like, obviously they got plans. They put a second IV and you took you to, or we're about to take you to the operating room and they had two surgeons there. Why did they have two surgeons?
I don't know why it was the MD, the medical doctor in there, and two surgeons, and
Mhm.
both trying to convince me basically like you have to do surgery. And even when I denied it at first, I said I want a second opinion. Um, I know the body has the ability to heal itself, especially intestines, if you treat them right. So that's one thing I know. But except the fact was I didn't have the right guidance. I didn't have anybody to show me this is how you do it. So
Yeah. So yeah,
besides
up till the age of 15 to now, you've never had a doctor basically tell you how you can get rid of this inflammation, right?
never
You've never had a conversation about it.
never
It's just like here's a medication, here's a colonoscopy, and here's some surgery, right? I mean, that's basically all you've been
that,
offered, right?
that's what it is. Like 22 pills a day I was taking. I used to go in for like Remicade. I forgot the name. There's so many different names. I'd have to
Yeah, what
sit
other
and get
meds were you
infusion.
on?
Oh, I was on everything. Um, Imurin. I don't even know what meds I was on. But as of right now, I'm not on any meds.
Yeah, yeah, yeah.
Nothing. Zero medications.
Good.
But it was bad. Like when I was in the hospital, even when I denied it and I asked for a second opinion, they took me up to a room the next day. They're like, "We'll just treat you with IV, no food or water for now to see how you react." And the surgeon kept coming into my room and saying, if you change your mind, this is my card. Like he gave me his card and everything to do the surgery, and I was just like,
It's
I
not
don't.
too late. Not too late to
Yeah,
get surgery.
basically, he's like, you don't, you can
Last
if you're
chance.
ready to do it. Yeah, like this is your last chance. And I was just like, no,
Now
and
you were joking about, so last time I talked to you on the phone was I think like a few weeks ago. You were joking like they had a psychiatrist come talk to you. Is this true?
yeah, of course. Yeah. When a psychiatrist would come in the room and be like, this is how you're going to be for the rest of your life.
They wanted to
Um,
make sure you were like sane,
yeah,
basically, or what?
like mentally, like basically they were mentally preparing for me to like accept this. Like they're trying to explain
Wow.
to me, like, this is how you're going to be. You're never going to be able to hold a job. You can't like
Wow.
do anything. You can't, basically you're just going to be at home bedridden. That's just how you're going to live.
That's wild.
And me psychologically, I'm just like, no, I'm not. Like I will fight it. Like I'm not gonna accept this. So
How'd you find me? Or what motivated you to look for me? And then how'd you find me?
so I'm always on Google and social media and YouTube, just
Hmm.
researching Crohn's, like how to
Okay.
treat Crohn's. I don't want Crohn's, and I'm in denial on the fact that I have it. Like I'm diagnosed with it, but I still think I was misdiagnosed or something. As
Hmm.
funny as that sounds, but like
You
I
don't
always
you
every
don't
day.
feel like somebody that should be sick, right?
Yes.
Yeah, it's not a part of your identity. Yeah, no, I get it.
No. Yeah. So like I've always denied it. I never tell anybody I have Crohn's ever. So but it's just something I have to live with secretly. And every day I'm on the internet and YouTube and looking for it. And then I came across your YouTube page. Uh and I heard your situation. You're like, I'm a doctor myself, and I had,
I had the
inflammatory
same,
bowel
I
disease.
had inflammatory bowel disease myself.
Yeah, yeah. So I was like, he's a doctor and he has IBD. So this is the first time I ever seen this in my life. I've never met a doctor that has IBD
I'm
and
actually a bowel surgeon, like
yeah,
intestinal
a surgeon.
surgeon. So like the crazy thing is I operate on people with IBD all the time, right? So
Yeah. So this is what clicked for me. So I was like, let me reach out to Dr. Desari. Let me see,
yeah.
what he can do for me. And behold,
Except you're basically in a hospital when that happened, right?
yeah, I was in the hospital and I
Wild.
was like, there was like a bunch of stuff. There's a lot of people on the internet that say like, oh, I can help you with your Crohn's, but none of them are MDs or surgeons that are telling you that. They're
Yeah,
just
and what
regular people.
info and did you get like was your sense that like you couldn't trust the information or that like it was not coming from a reliable source? Like what was the like how like I guess you've been researching for a while, right? Like how'd you arrive on like, hey, this is the guy that's gonna help me get things done? Like how was that?
Well, the fact that you're the only one that's a surgeon, and one thing I know about surgeons is they don't have time. Like their time is they
I
don't
don't
have.
have time either. I told you
Yeah.
we gotta get
Yeah,
rid of this in 6 weeks.
you make time for people. So to help people because you genuinely want to help people. You suffer with it yourself. So there's a way, that you can understand. Like if I tell you my symptoms, you won't like you're the only person that can actually relate to what I've gone through.
Peter, I'll tell you something interesting. Like so obviously I've been in practice for about 12 years. So I've operated on people that have had Crohn's, colitis, that like have failed all their medications, have had obstructions. Like I've done hundreds, if not thousands of these operations, right? And it's like when you're in a hospital, especially in the emergency room, and you see someone with an obstruction, you're like, oh my God, I gotta get them home, right? I gotta get them like eating, right? And so there's never even a chance or time to talk to folks about like what you can do to prevent that kind of inflammation. And so
Yeah.
it becomes really, really difficult. Actually, like I fixed my problem almost 15 years ago, right? And I didn't think anything of it until like I would say in the last 6 or 7 years in my clinic when I started getting folks that were like, hey, I'm getting a little bit obstructed, or hey, I got adhesions, I need some surgery. And I'm like, hey, why don't we just try this regimen out? And when I was doing it in the clinic, people were getting amazing results. Even the gastroenterologists were like, what are you doing, man? Like you're putting us out of business, right? So,
Yeah.
and I was, it was bad for business, right? Because I couldn't operate either. So, I keep joking with people. I was like, if I succeed, you won't need an operation, which is a good thing, right? You won't need me, right? But I'm also like you. I am impatient. I'm impatient by nature. So I'm like, I want to see results fast. And so what it used to take me almost a year to a year and a half to successfully like coach people about what proper nutrition looks like, what proper exercise looks like, what proper sleep, stress, all of these, these factors that drive inflammation, how to optimally manage it. It used to take me a year to a year and a half, right? And then in the pandemic is when I really started like putting together things all together and trying to make like a bunch of videos for my patients in clinic. And then I was like, okay, well, I have this thing done. Like, why not like just put it out there that like I do this kind of work, right? And it's just been and this wasn't meant to be like like the primary focus of my practice. Like I'm a surgeon. I've actually got quite like a very robust, healthy, busy surgical practice here in Las Vegas. And then I came to find like after I launched this whole project, I'm getting a massive amount of people just kind of like you reaching out to me and saying, hey, like, can you help me with this? Can you help me with this? And like, please provide me some education on these topics, right? And and now like almost like a year later, it's just been like crazy, like in terms of like how many people that I've been able to help, which is really nice. And so yeah, I just started doing this sort of format of like, doing like these like recording my Zoom calls like we're doing now, because before I was like, oh, whatever, I've got plenty of people. But I think like you were actually saw one of my videos, right? That was like someone else
Yeah.
who had beaten inflammatory bowel disease.
Yes.
It gives a lot of like confidence in a situation like this. And so I started beginning, I wanted to really like get more stories right out there, and so that people could really see like real people getting better. And so that's really been my primary motivation at this point.
Yeah. This plan that you gave to me is life changing. It's eye opening in many ways because there's a lot of things I did not know.
Like what? Like what?
With the diet, exactly, like what to eat and anti-inflammatory and bacteria and like how to change the bacteria and the microbiome in your gut and all these things. Like I had no clue. I had no doctor. I don't even know what the word microbiome was until I started. I'm not joking. Until I started like doing the program, like until I signed up for the program, I didn't know what microbiome was. I'm like, what's microbiome?
Yeah, well, the microbiome is the number one, the altered gut microbiome dysfunction
Yeah,
is the number one reason people get inflammatory bowel disease. And
yeah,
people like to blame genetics, right? People are like, oh, you got genes that are bad. Well, it's not your genes that are bad. It's the bacteria's genes, it's the virus's genes, it's the fungal genes in your system that are bad, right? And
yeah,
people just and those things we can fix. We can fix them actually pretty fast. Like you went from so just so people know this, you went from basically totally obstructed in a hospital, two surgeons asking you to basically get pleading with you to go get an operation. You were like,
multiple times.
I'm not really sure. They bring in a psychiatrist to make sure you're sane. Okay, this is all 3 months ago, right? This is
Yes.
3 months ago. And now you're basically off all medications with a very low fecal calprotectin level, and you're eating more or less this a normal diet, right? I mean, not a
Yeah,
normal, it's the phytonutrient diet, but
yeah,
it's within reason. But you're not drinking liquids only, right?
no,
You're eating solid foods. You're going to the
yes,
gym. You're working on your business. You're like a real person now, right? I mean,
yes.
and then so yeah, I get it. I mean, that's kind of crazy. What has been the biggest challenge you would say? Because do you remember that first couple weeks we were chatting? And
Mhm.
the biggest challenge we had was we had to we had to personalize each of these little protocols for each person. And the biggest challenge for you was two things I noticed. First one was you couldn't eat solids, right? And you can
No,
barely take liquids because you were totally obstructed, right?
I
So we had to
couldn't.
modify the diet to where you were still got some decent amount of calories, but then you could at least pass things through your stricture, your obstruction, right? Because
Yeah,
once you left the hospital, it was like barely open, right? I mean, like it was totally closed when you were in hospital, barely open by the time you went out. And we basically used that little like passageway to like,
yeah,
get the results we wanted. But so at first you were like highly restricted, right? Like we only doing like shakes and things like that. Um, and then remember you always had like your doubts about certain foods that I would suggest. You'd be like, no, 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 that's a no-go. Like I don't want to
yeah,
do that. We
yes,
got into like so many
yeah.
arguments over the
Like
phone.
lentils and stuff like that. Like I couldn't. I was like freaking out about eating it. I just had like there. I was just in phobia. Like I had a phobia of it because I didn't want to.
Because in the
Like,
past you eat these foods and they cause problems, right? Because
yeah,
when you have a messed up microbiome, like food, like certain foods will make you feel bloated, or make you feel gassy, right? I mean,
yeah,
so we were having this debate. You're like, no, I don't want to do it. And like I was like, okay, fine, don't do it.
yeah,
So
yeah. No, I know. I had a lot of discomfort and the foods I thought were helping me because I was like, this is what I eat. This is
yeah, what were
part
you eating before?
of
Chicken
like
and rice?
rice. Yeah, just chicken and rice a lot, and then
You're like the 10th person to tell me that this month.
yeah, I like just chicken and rice, and then
Uh,
I just that's what I would eat. But in reality, that was actually not wasn't doing anything for me. It wasn't healing me. So
maybe causing your problems to worsen, right?
yeah,
So
so basically that's what it did. It caused my problems to worsen over time to the point where I ended up in the hospital and they wanted to cut me open.
yeah.
So I needed real help. That's what I needed. Like cutting me open and medications and these things. What's going to happen? I'm going to end up right back there again, and they're going to just have to cut me right open again. It could be a year from now, 5 years from now, regardless of the situation, it's going to be the same pattern, same thing.
Yeah,
But
I've actually seen a lot of clients that have had multiple surgeries over the course of like their entire diagnoses.
yeah,
You know the thing that amazes me, Peter, is like you've had some of these people have had like 5, 6 surgeries and like intestine removed, they've had strictures removed, what have you, adhesions removed. And every single time I ask them, has anybody spoken to you about what causes this problem to occur? Has
Never,
anyone talked to you about diet, digestion, sleep,
never.
stress, exercise? Not even a single conversation, right? And,
No,
and then here's the other thing. Even on the internet, there's not like a whole lot of like consistent information about these topics. Most of them are, most of the places you'll read will be like, yeah, none of that stuff really matters, has never been shown to help. And like, I think in certain, like, obviously, if you look at medical studies, right, the way they do these interventions is like they just offer a diet, but they don't offer coaching. They don't offer like feedback. There's no like, it's a controlled setting, right? But in my experience, it's always been the exact opposite. I've yet to meet somebody that doesn't get better if they actually follow the program and like give me feedback and I give them feedback. It's like like kind of like a coaching relationship. I've never really seen people not get better. And so the only folks that don't are like the ones that never try or never do anything, like you said, right? Like if you're just like kind of roaming around and stuck in your ways, then it just becomes a problem, right? But
basically, like all it is the doctor's telling me that it's a mutation in your DNA. This is what it is. There's no cure. Here are the medications, but no, like they give you like a diet plan, like a stage diet, but everything in that stage diet is bad for you. They don't discuss with you like,
right.
hey, these are inflammatories. This creates more inflammation.
What did
Uh,
they have you what did they have you eating at the hospital?
when I was in the hospital, right at
Little
like,
Ensure shakes or whatever.
yeah, they put me on like, like they brought out like a spicy bowl of like soup, like
Yeah.
some spice. It was like really spicy and like whole milk, like cow's whole milk, and like all this chemical based like protein thing.
Ensure shakes or whatever.
Ensure, like
Yeah.
all these things that are just direct cause to
It
inflammation.
just make it worse, right? I know.
Yeah, I was like, they want me like basically like this is I'm gonna stay here like for another month, like
Yeah, you were
for
lucky to get out of the hospital, I think.
extremely lucky. I thought like I was not gonna get out, and I didn't think that like I was gonna be able to make it out within a week,
Yeah.
without a surgery. So I've been trying to avoid surgery, but now I'm able to function 100%. Like I can live right now, which is good without medications.
Yeah.
So it's shocking, but I'm living proof. So
Yeah, so around the 3 month mark, right around now, is when I teach people how to like cheat on their diet, right? And
yes,
because it is a restrict. It's so most of the things people get used to. People get used to getting to working out. They get used to getting better sleep and sleeping earlier. They get used to some of the stress management things that we work on, right? I had you meet with like a trauma awareness coach and a couple other people, and you're like, I don't want any of that stuff. I'm fine, right? But a lot of people, there's a lot of trauma here, right? Like I know you don't like, you're like Middle Eastern, you don't think about all that stuff, but like it's a real thing, right? We all know
yeah,
it's a
we're not allowed to show our emotions and our culture. We're not allowed to cry. We're not allowed to complain when we're like our role, as like men in our culture. Like we can't complain basically. Like
yeah.
whatever happens to us, we just have to keep it in, bottle up. We can't like if we tell somebody, oh, I'm gonna go meet with this psychotherapist or psychiatrist, it's like very frowned upon
Yeah. And
in our culture.
it's good that like in the program we just have an awareness coach, right? It's not so much
Yeah,
like a counselor trying to dig into like deep dark secrets or anything, right?
exactly.
But it's helpful, right? Because it's just to be aware of those things. Not like you have to like it's just awareness, right? You just have to be aware. And so, diet, digestion, sleep, stress, exercise, we optimize those. But around the 3 month mark, when you're we just got lab tests back and the labs look great, right? This is like a
Yeah.
few weeks ago. And I was like, we need to film a Zoom together so that we can talk about it. Like you have
Yeah.
normal labs, your fecal calprotectin is basically near normal levels, right?
Mhm.
And then, so effectively, you don't have any active inflammation, and that stricture managed to open up to the point where you're eating normal foods, right?
Yes.
And you're off steroids, right?
No steroids. I was on prednisone
In the hospital, right?
in the hospital.
Yeah,
Yeah, they were loading me up on prednisone. and a bunch of antibiotics. But as of right now, like as soon as with the program,
Mhm.
with the combination of the program, as I was tapering down the prednisones, I was not like having the same symptoms I've always had, which is
I
this
have a
severe.
question about the tape. I have a question about I get this question a lot about the taper, right?
Mhm.
So obviously the gastroenterologist who is managing the steroids, they're not going to tell you, hey, just come off the steroids and do nothing, right? They're usually going to convince you, hey, start a biologic or something, right? How did you manage that challenge? Like, what did you do? Like, what, I mean, I know you haven't I know you
Yeah.
switched gastroenterologist, right?
Yeah. No, I mean, the biggest challenge was I was, getting scared, like, how am I gonna, how are my symptoms gonna react as I'm coming down off these meds?
Mhm.
And I just, told myself like I gotta, be a little bit mentally strong during this time, and follow the process and just give it a shot. What do I have to lose? Giving this a shot and just listening to the Dr. Dasari, because the reason why I was very confident is because one, you lived with IBD and you're a surgeon. So I was like, I'm listening to a doctor's protocols, one that's actually lived through it himself in his shoes. So that's what gave me the confidence. That's what gave me, the mindset to be able to follow the protocol and wind off meds and deny taking, you know, any extra medications.
You basically stopped on your own and switched gastros, right? I mean,
Yeah,
that's kind of what happened, right? I mean, there wasn't like you were secretly telling them one. I mean, I've heard everything under the sun. I've heard people just like stop them on their own. I've heard people, and I don't encourage. I remember you asked me. I was like, I don't encourage anybody to stop anything at all.
yeah,
Like, it is a independent decision when that happens. But if you
mhm,
need help and support in how to be victorious, I'll tell you how to do that, right?
yeah,
And so the interesting thing is, like, I've had people that work with, like, some gastros are very flexible and they're like, okay, let's see what happens. Some people are like, heck no, you got to start a biologic, and they give them the biologic, right? So some people go on biologics for a short period of time. I've had
yeah,
people basically kind of like you, they're like, yeah, you're fired. I'm getting another gastro. And in that window of time before they go from one to another, they basically get better. You know what I mean? And I've had, so I've kind of seen every way in which this is done, but I just wanted to ask you because I get this question a lot, and I try not to give medical advice in the sense of like trying to say, hey, stop a medication that was prescribed to you, because that's not my role. My role is basically to tell you, hey, I'm going to give you all the tools you need to decrease inflammation in your body, right?
mhm,
And so you have the confidence to know that at least the root causes of the disease are like resolved, right? So
yeah.
um yeah. So what was, I guess, what have you been doing the last couple? I mean, you've been feeling great last couple of weeks, right? And now we're focused on reintroducing certain foods. I think that was more of a concern for you early on, right? You're like, when am I going to be able to eat my chicken and rice? But now
Yeah.
your mentality has totally shifted, right? You're kind of like, I don't even miss some of the foods that I was wanting, right?
No, I don't. This is the crazy thing for me, about this whole program is I don't crave what I used to crave. Um, Probably it's because like the bacteria in my body, like we changed it around, like we started feeding the good bacteria versus the bad ones. So
Right.
that's where all the cravings were coming from, when I discovered. But
That's
now,
very true. There's actually, like, Dr. Gundry would always talk about how the bacteria in your gut are sending text messages to your brain about what to eat, right? And
that's
so
what it is. That's what I used to feel. That's the reality of it. But now I don't crave those things anymore. Now I just crave what makes me feel better, which
right.
is all the healthy food. Now, like I have a very good understanding of food.
Mhm.
I learned that there's a difference. There's two kinds of food. Like there's either products or food. So either you're going to eat food or you're going to eat a product. And now I know the difference between what's a product and what's food.
Yeah.
So
And
I
we have a
became
lot
very
of products. Everything is a product in the United. Who told you that, by the way? Who said that to you originally?
It's a doctor I found out on YouTube. I forgot
Yeah.
his name. I need to look him up. But he has like a bandana. He wears like a bandana, and
Yeah.
I
I
listened
gotta
to.
I gotta use that. I told you I gotta use that one, right?
Yeah,
Eat food, not products.
yeah, and then I realized that like 90% of everything we eat is a product.
Yeah.
Probably more, like close to 100% of everything is a product. And then I realized like this is how we're supposed to eat. this is how humans are supposed to eat.
Now you had 15 videos, right? Remember I said it used to take me a year and a half to educate people on this whole thing.
Yeah.
How fast were you able to get through those 15 video modules? Because I basically boiled down what used to take a year and a half. I boiled it down to those videos. Like how long did it sort of take you to digest that?
Less than in a day, I would say.
Yeah. Oh, you
Less than
finished in a day. That's great.
Yeah, I mean, like it's just videos. Like I watched in a couple days, I think. Like wasn't well, me, I was very like adamant and dedicated.
Motivated.
I was like, I was motivated. Like I wanted to like knock this out quick.
Yeah.
So I was just on it right when I started. But it was not like something that took months or years, for me. It was just instant. Like I watched all the videos and then I did my own research. I did my own due diligence as I was watching them, and everything just added up. The more research I did with the videos, everything just made complete sense for me.
Yeah.
And that's what motivated me. And I was like, finally, there's a light. Like I finally feel like there's a light in my life. Like I can now, like, I'll be able to function without meds and ending up in emergency rooms where doctors are trying to cut me open and stuff. So that's the good thing.
With psychiatrists asking if you're insane.
Yeah, and psychiatrists telling me this is how you are forever. Are you okay? This, and I'm like, but the good thing is this program it wasn't complicated. It was nothing. There was nothing complicated about it. It's very black and white. There's nothing it's not gonna mess up your life. Even if you have a really busy life or whatever's up with your life, it's not gonna cut into that.
Because you are very busy. You're like, you're working, you got a business, there's a lot of stuff you're doing, right?
Yeah, I'm a very extremely busy guy. I've always been very busy. I work full time and I own a business full time. So I do two things at once. So I don't have time for Crohn's disease.
You don't have time to be sick.
I don't have time to be sick. No, like sick, like it can go be sick somewhere else, but not with me because I got things to do.
Yeah.
So I got places to go, people to see all the time. So I can't.
Great.
Yeah, I can't be dealing with Crohn's disease, and this was perfect for me. Even as I'm on the go always, I was able to function with this plan.
Peter, what are you looking forward to the most now that you're off all meds, no inflammation? What's the next big plan? What are you doing?
Right now, like my goal is to travel, because I've never been able to actually travel, and I've been doing like staycations. I'm in San Diego, so I've been doing staycations, and I did like a 3-day one recently. And like nothing bad happened to me or anything, which I didn't think that was possible for me to do, is like stay at a hotel and stuff like that and go have fun. Like I haven't been able to do that for a long time. I always have to usually worry about like the bathroom, like where's the bathroom? Like my friends, they always invite me to like desert and stuff like that, camping, and I'm like, oh, there's no bathroom there, so like I can't go. But now it's like it's crazy because like now I don't think about like, oh, if I go somewhere, I have to know where the bathroom is. Like I literally would Google like where the bathroom is, like at the place that I'm going to. Yeah, that's how bad it was.
So yeah, forget about those long haul flights internationally too, right? So.
Yes, yeah.
Well, that's great. Thank you so much for doing this. I really appreciate it. And I know, like, we had an update meeting. Things were going pretty good. I think we're focusing right now on just making the diet a little bit more sustainable and just, getting more labs. And then you have a colonoscopy, right? Already scheduled. But
yeah, I have a colonoscopy I'm supposed to do soon. I don't have a specific date. They haven't given me a date yet, but I'm supposed to go through with the colonoscopy soon.
Yeah, but even your stricture wasn't in your colon; it was in your small bowel, and so so the colonoscopy is I would assume going to be okay because your fecal calprotect and all your inflammatory markers are normal. So if anything, they may see some like old inflammation, right, from like the years and years that it was around, but probably nothing active. So that's good.
Yeah, I'm stoked. So I get to function. That's the main thing. So as long as I'm able to function and do, live my life, that's all that matters. And I don't need to worry about like I have to take this antibiotic, this pill at this time. Like I'm not doing that right now.
Yeah. So. Well, great. Thanks, Peter. I really appreciate it. And hopefully we'll get an update from you soon in the next couple of months also.
Of course. I'd love to. Yeah, definitely.
So I hope you enjoyed that segment. Crazy story, huh? With the mind-gut immunity approach, we optimize diet, digestion, sleep, stress, and exercise. Also, if you enjoyed my content, be sure to like and subscribe. And if you think this would help someone you know, be sure to share this video. And as always, I'm Dr. Chanu Dasari, and I'll see you next time.